Well, in this week's Cardiology Countdown, we'll talk about PCI trends and 2 trials of PFO closure. So to begin with, we have a 20-year analysis from the SCAAR registry, the Swedish registry of all interventions, where they look at the change in indications and demographics of patients over the period from 1990 through 2010. Interestingly, the percentage of patients presenting for PCI with acute coronary syndromes increased dramatically, with unstable angina going from about 1/4 to half, and STEMI being initially just 6%, but up to 1/3 of patients presenting. So all told, nearly 80% had acute coronary syndromes of one type. They also found increases in diabetes amongst the patients presenting from PCI, not that surprisingly, unfortunately, but there in Sweden, seeing this trend as well. When they saw mortality in unadjusted was higher, but there were many more ACS patients. And so when adjusting for acute coronary syndrome type, they actually saw trends in decreasing mortality, especially in the STEMI population. And that's certainly been seen as more primary PCI is done. Next up is the first of a pair of studies in the New England Journal that look at closure of a patent foramen ovale with percutaneous devices. And so PFO closure has been a hot topic, and long duration of clinical trials has been ongoing, and finally now in print in the New England Journal. The first of them, the smaller of the 2 trials, is the PC study that enrolled just over 400 patients. And it found a trend toward benefit with about a 1/3 reduction in development of stroke following PFO closure as compared with medical therapy, but this was not statistically significant. They point out that the modest sample size could have been an explanation. But the number 1 spot is a second trial, the RESPECT trial, that was much larger, 980 patients enrolled. And in this study, they saw a very strong trend in the intention to treat analysis for a reduction in stroke when doing PFO closure as compared with medical therapy with antiplatelet treatment. And so the rates of stroke were 9 versus 16 in roughly 500 patients each. And so the hazard ratio of 0.49 and a p-value of 0.08. When they looked at the per protocol analysis and the as treated analysis, both of these differences were statistically significant, and SAEs were not different between the 2 groups. And so from this, one could surmise that in the right patients in whom you're able to carry out PFO closure, that it does appear to be protective against stroke. So for this week's Cardiology Countdown, I'm Chris Cannon.